Welcome, 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 my Be Health Empowered family, to another week of Excuse Me, Doctor. Now, you all who are watching me know that I'm Dr. Mel, otherwise known as Dr. Melissa Clark. And so, to all my newbies that are joining us for the first time, welcome. I am delighted to be here with you. We're back here doing what we do each and every week on Excuse Me, Doctor. We're making sure that you have the information that you need to make wise health decisions. And of course, we're streaming on Facebook, we're streaming on YouTube. And if you're joining us for the first time, or even if you have been coming to see us and you haven't done this yet, please hit like on Facebook and subscribe on YouTube, that red button. Really, really appreciate you for that. And you all might recognize, those of you who watch me on a regular basis might realize my background is different. And that is because I am coming to you live from Atlanta. I am at a health equity conference. Just making sure that everybody has the same opportunities to achieve their best possible health. And that's why I do this show. And so I'm just getting renewed by being at this conference, but I definitely did not want to miss the chance to connect with you all tonight. So here I am. And of course, I have to bring on my incredible co-host to help us make this amazing week that we're going to make for ourselves, kicking it off with accurate health information. And that, of course, is none other than Mr. Wayne Bruce. Wayne, you there?
We there? Are we there?
Right.
I'm here all the time, Dr. Mel. I'm here
Right,
all
all
the time.
right.
How are you?
I am doing great.
How's everything
Excited
down?
to be here.
How's everything down at your conference? You're not in the studio, so everything is new and exciting down there.
Right, right. I had to put together my own mobile studio. So impressed with myself, I must say. And everything is great down here in Hotlanta.
I am impressed with you also. But you know what, Dr. Mel, I'm excited about this show. But before we get to the show, we have
Uh-huh.
some great news. We're coming back. This is the come around,
All
right,
right.
Dr.
Do we
Mel?
need a drum roll?
We need a drum roll. I like to. They say, "What did JC? Let me reintroduce myself."
Okay. That's right. He did say that.
She said, "Well, for this one, we have to reintroduce Bria. Good as I.
All
It
right. There
says
she
guest
is.
host. It says guest host, but I hear some things that it might not just be guest host. And
Right. That's what I heard too.
I heard I heard it might not be guest host. Is that true, Bria?
Hey, look, I came back and I'm here to stay. So, and I could do the H to the OV, make it B to the RI,
That's it. That's
So
it.
you reintroducing yourself. Okay.
Hey, everybody, it's so good to be back on the show. I missed y'all for a couple of weeks I wasn't here, but we back. We better. We're here to stay. So I'm so
All
excited.
right. Well, we are excited to have you back. And yeah, it's gonna be great. It's gonna be
Yeah.
great having you as a co-host.
Great having you, Bree. We're excited. I'm also excited about tonight's show. Because
Yeah.
tonight's show is desperately needed. It is October, and it is Breast Cancer Awareness Month.
Absolutely. And so we are kicking off Breast Cancer Awareness Month with letting everybody know how to navigate a new diagnosis of breast cancer. So, this is breast cancer after the diagnosis. What do you do? Who do you go to? What should you know? We are going to be covering it all with an incredible two guests who are here with us tonight. So, y'all have to stick around because it's going to be an incredible amount of wonderful information. And you should share it with anybody you know who is recently diagnosed with breast cancer, who's been on the breast cancer journey, because we want to hear from them too. We want them to put their comments in the chat. And, we're going to answer all your questions. So put those in the chat too. So
Right.
it's going to be a great show.
This subject is near and dear to my heart. If you don't know, some people don't know, I lost a sister to breast cancer. So it's near and dear to my heart. So and in this show tonight, our guests it's old home night for us. We'll get to it, but it's old home night for me. All right.
Absolutely.
So
Absolutely.
like Dr. Mel said, share the show. It will help your life. I think something's great going to come out tonight.
Absolutely. So what time is it? Is it that time?
It's time for all the news in health and wellness for the past week. It's recap time. Let me move that. I gotta move the pink ribbon from my face. There we go.
And I see you were dressed appropriately in your pink shirt. So thank you for saluting the Breast Cancer Awareness Month with the appropriate garb. So,
well,
yes.
I pop my collar. If I'm gonna pop my collar, it's gonna be in pink.
There you go. There you go.
I ain't so sorry. Neutralizing the party. But let's get into this recap. So let's get into COVID first, because COVID's been here to stay. So, Dr. Mel, I heard that about 40,000 people died from COVID over the summer.
This is true. And people don't realize that, we've been hearing 300 people a day, 400 people a day. But when you kind of think about it all together, 40,000 people have died over the summer. People are still getting hospitalized and dying from COVID. They're predominantly people who are over 50, mainly over 65. But we're seeing a pattern. And that pattern is this: hospitalization and death is 6 times more likely if you're unvaccinated. And it's also higher for those people who are not yet boosted. So again, cases are going up in the UK by 30%. We're expecting that that's going to happen here in about 3 or 4 weeks. Now is a great time to get vaccinated and boosted.
And this is like right in time for Halloween, Christmas, Thanksgiving, all the indoor activities. Like, it's time to start getting maxed, right? Like, put on your mask. Don't be afraid.
Yep. Do that. And if you're over 50, definitely get boosted if you have not been boosted yet. And if you're 12 to 50, get boosted, get vaccinated to cut your risk of spreading it to other people, to lower your risk of getting sick and, being down for a few days, and also to lower your risk of getting long COVID. It's a win-win-win. So there you go.
Yeah. And if you keep that mask on, you can wear it as a Halloween mask. I'm just saying.
Bedazzle everything, decorative, colorful.
It'll fit right in. Fit right in. So look, Dr. Mel, I've been in the studio recently with someone who kind of drifts off to sleep a lot. And I questioned him because I recognize that recently sleep apnea for Black men has been that silent killer. And since I was him years ago, and I want to apologize to all the people I fell asleep in the studio with.
Wow.
But tell us more about sleep apnea in Black men.
Yeah, well, earlier this year, a study showed that in the last 20 years, Black men have been dying from sleep apnea more than any other group, more than white people, even more than Black women. And other groups' death rates from sleep apnea have flattened out, but Black men's have continued to go up. So that's the big news.
What is sleep apnea? Break that down for us, Dr. Mel.
So it's a disorder where your breathing repeatedly stops and restarts during sleep. You might have heard like people snort in their sleep or gasp for air. It's because they're not getting enough air into their body, not enough oxygen. Their body becomes oxygen starved. And that can lead to a host of other problems: high blood pressure, diabetes, weight gain. So, actually, one of the reasons I brought this up was because, I'm the medical correspondent for the medical contributor to the Russ Parr Morning Show. And he called me over the weekend and said, hey, I have sleep apnea. What do you know about it? Can we talk about it on Monday? And so we talked about it this morning.
Wow, that's incredible. And it could even lead to death. I know I got a wake up call when one of my favorite football players, Reggie White, died from sleep apnea. I mean, I look at James Gandolfini from The Sopranos. He
From The
died from it.
Sopranos, right?
Yeah, I remember they had a big thing on Amber Sports. People could tell I'm a sports fan, right? Shaq has has sleep apnea. Quincy Jones. The list goes on and on.
Yeah. So, then the question is, why does it seem like Black men are dying more? And, sleep apnea is painless, right? So it might not be a priority for people to get diagnosed. And then the treatment, which is a device that helps blow air into your body while you sleep, sometimes people's insurance, they might not be able to afford it. Um, and or they might get it and not use it because it's might be difficult for them to use. So all these factors might be contributing, but I think this is really a wake up call. I think for anybody who snores, anybody who feels tired when they wake up despite a full night's sleep, or has a headache when they wake up despite a full night's sleep, anybody who falls asleep during activities like being in the studio, like you said, or driving or at work when they shouldn't be falling asleep, all these are potential telltale signs that you might have sleep apnea. So talk to your doctor about it, get a sleep study, which is the way that it's diagnosed. And if you are diagnosed, follow up and use that treatment, because that treatment can save your life, which is that CPAP device.
Fantastic, Dr. Mel. Fantastic. So
I know a couple of people in my life who also have sleep apnea. So it's really, really important to think about this as well. Kind of switching gears from sleep apnea, want to start talking about this brightly colored fentanyl. It's a thing now. They're like the opioid epidemic, the crisis, it's just keep on going up and up and up. So let's talk about this fentanyl.
Yeah, so this is a thing. The DEA is warning about these rainbow colored pills that have fentanyl in them. They've been seized in 21 states now. And so we're trying to just raise the alarm because they're being marketed to kids. They look like candy and they're being sold on social media. And so kids might be getting them thinking that they're getting some, something fun, some sort of illegal drug, but because it looks like candy, it looks harmless. So that's really concerning, and everybody should know. And we're showing a picture of them now. They look like Skittles, or little candies.
Incredible.
It's so crazy. Me and my mom were just talking about this because she's a teacher in the school system as well, and her kids, who are 7th, 8th graders, were talking about this, right? And I know that you recently talked about this as well, Dr. Mel, on the Red Table Talk, right? So for all the viewers, you haven't seen that, go take a look at that and watch it with your kids, because this is so important.
Yeah, and we actually here on Excuse Me Doctor, we did a show on fentanyl about 3 weeks ago. But we know that fentanyl is a pain medicine. It's made in a lab. It can be 50 times more powerful than heroin. And so even a tiny amount can be lethal.
Wow.
And about the small amount, like on a pen, right? Like the smallest amount on a pen. So it's kind of hard. Is it possible or is it impossible to kind of figure out whether these pills have fentanyl or candy?
It's really hard. They have these things called fentanyl test strips, but kids aren't going to be using that. They're not really going to be thinking about that, but there is a way to sort of tell. But it's leading, as you said before, to a record number of deaths, over 100,000 a year from fentanyl alone. So it's an epidemic, and parents really need to be conscious. Talk to your kids about it. Talk to them over and over and often about it.
Yeah, please, because we got to protect the kids. So now talking about STDs. So we talked about how everyone is getting together, it's the holiday, but people are forgetting to put their raincoats on, Dr. Mel. So let's talk about this STD crisis that's going on.
That's what it looks like. I mean, syphilis, gonorrhea, chlamydia, all-time high in the United States, disproportionately among young people. Black people were 32% of the population. Sorry, we're 12% of the population. That was wishful thinking. We're 12% of the population, but we're 32% of the cases of chlamydia, gonorrhea, and syphilis diagnosed. So that's why I thought it was really important to talk about this tonight. And it's not like, obviously it's uncomfortable to have an STD, but the consequences of it not getting diagnosed and treated are much worse. They include loss of fertility for women, especially tubal pregnancies, cervical cancer. And if you have an STD and you give birth to an infant, unfortunately, that baby can be born infected with a bunch of consequences, including death. So it's high stakes, and it's important. If you're sexually active, please use a condom, talk to your doctor, get tested regularly.
Yes. Please. I remember you saying you're in Atlanta. Georgia is actually one of the top 10 states with some really high STD problems. So yes. We can't be having this happening. And what are some of the symptoms that people should be looking out for?
Yeah. So, well, both men and women can have a discharge, itching, and for women especially, actually, and pain for both men and women, especially men on urination and ejaculation, and women, pain with intercourse. If it's really bad, it could be just walking, riding in a car.
Wow.
So and abnormal bleeding. So all those are possible symptoms. Wow. And of course, rash. I shouldn't forget rashes. Those are also possible symptoms for men and women.
Please, y'all.
Put on your rain jackets. It's a storm out. Put on your coats.
It's true.
You think you would have learned something coming up.
Rain, no.
Yeah.
Make sure for the men, make sure those soldiers have helmets.
This is true. This is true.
Everybody's. So look, I don't mean to make light of it. Also, someone put in the comments, look at the look on Wayne's face. Yes, my face was a little, I can't hear about it. And then another person put in the comments, I thought this was about breast cancer. Let me say this. Breast cancer is coming up. Just stick around. This is
about breast cancer. So you must be joining us for the first time. We always run through the news of the week, and then we're going to get into the topic. So just stick in there.
Hang in there.
It's coming right up. It's coming right up.
There. But look,
and we have one more weekly recap topic to hit, right, Wayne?
Yeah, it's Monday night. Well, we tape on Mondays. Let's say that. And yesterday I watched football games, but I was reminded that last week, or in some previous weeks, concussions have been the topic of discussion in America, and especially with the Tua incident in Miami, where he hit his head and laid on the ground and kind of went into a seizure type of thing. Talk to us about that, Dr. Mel.
Yeah, and what he experienced is actually, when he got up and was stumbling around after that first hit, that is actually a telltale sign of concussions. Most concussions do not require loss of consciousness, so a lot of people get it confused. And he did not lose consciousness either, that first time. A lot of the other symptoms include a headache, blurry vision, nausea, dizziness, brain fog, problems with your memory, being bothered by light or by sound. And this all comes from trauma to the head. It indicates your brain isn't functioning like it's supposed to. And if you haven't healed from a concussion, and they put you back out on the field, like how happened to him, the second time you get hit could be actually much more serious. So they missed the opportunity to put him on that NFL concussion protocol, but he's on it now. And athletes in general should never return to play or vigorous activity while they still have signs of a concussion, and never the same day as a concussion happens. So if you or your child gets one, see a doctor within 1 to 2 days. even if emergency care isn't required, because there's a protocol for us regular folk too if we have a head injury. So definitely be seen by a doctor.
So Dr. Mel, a concussion can kill you, can it?
It can. It's rare, but yes, it can. Yes.
Okay. Well, we'll leave it on that note, and everybody get checked out. Don't let your child play with a concussion. Do you know what time it is, Dr. Mel?
What time is it now?
It is time for
the weekly debunk, stopping misinformation in its tracks.
This message came to me today because they heard that Bria was coming back on, and Taniska, the distant cousin of Tyrone Twitter Fingers, Taniska Twitter Fingers, hit my phone somehow. She said, I know this is Breast Cancer Awareness Month, but what they don't want to tell you is that marijuana is the best way to cure cancer. So I hit her back and said, I don't know about that. Excuse me, Dr. Mel, is that true?
No, it's not. Marijuana was actually one of the most popular alleged cures for cancer on social media. This is according to a Stanford University study. On a scale of 1 to 5, with 5 being total truth, this is about a 1. There's a grain of truth here. But the bottom line is weed alone is not a cancer treatment. So this is how it works. There's some proven benefits to the chemical compounds that are in marijuana. They're called cannabinoids. So like THC and CBD. And they actually are extracted and purified and used to treat a bunch of stuff like nausea, vomiting related to cancer chemotherapy, treating pain in cancer, nerve disease, or stimulating the appetite of cancer patients and HIV patients. A small number of studies have shown that some cannabinoids can slow the growth of cancer cells, but that's been done in lab dishes and in animal studies, has not been shown in human studies. So it doesn't show, we don't have any studies yet that show that cannabinoids found in marijuana can help cure or control cancer. And then on the flip side, if you're smoking weed, it is definitely not a cure for cancer, because the carcinogens in the smoke can actually make things worse for you. And because marijuana plants come in different strains, every user's experience is going to be difficult. So it's really hard to say, smoke 3 joints and see me in the morning kind of thing, because it's not regulated. So the bottom line is more studies are needed. But relying on marijuana alone as a sole treatment while avoiding or delaying conventional medical care is just not a bad idea. It's not a good idea. It's a bad idea. And I think you should tell Taniska, is it, that that's definitely not the case.
Tanishka.
Thank you. Tanishka.
Twitter Fingers. Yeah. It's part of the Twitter Finger legacy that every name from the Twitter Finger family is spelled with a T.
Okay. Well, thank you all we're going to catch you a little bit later, but now we are going to move into our show tonight, our topic, kicking off October, Breast Cancer Awareness Month. We know that a woman's lifetime risk of breast cancer is actually 1 in 8. And for women under 60, breast cancer is the most deadly cancer. Black women actually have a 31% rate of dying from breast cancer if they get it, which is the highest death rate of any ethnic group. Even though breast cancer overall is going down, the cancer rate. But it's October, it's Breast Cancer Awareness Month. So we are going to walk through and speak to what do you do after a breast cancer diagnosis? What should you know? Who should you go to? We're going to be covering all that. We have an incredible guest, Dr. Regina Hampton, who's a board-certified general surgeon who specializes in breast cancer surgery. She's ranked as one of the top doctors in the Washington, D.C. area. She's a powerhouse when it comes to helping Black women get screened and know their options for breast cancer. So welcome to my colleague, my Howard University colleague from back in the day, Dr. Regina Hampton. Thanks for joining us.
Thank you. Thanks for having me.
Absolutely. And then we're going to go to our next incredible guest, Miss Sandra Beard. She is a Washington, D.C. native. She's a mother of two, and she is also a breast cancer warrior, survivor, champion. We welcome her. Thank you so much for joining us.
Good evening. Thank you.
Absolutely. And so I'm actually going to start with you, Ms. Hawkins Beard. I understand that you were diagnosed with breast cancer just 4 years ago, and it was with a routine mammogram. Can you tell us what it was like after you heard the diagnosis?
Ooh, surprising, very surprising, because it was a routine yearly mammogram, and wasn't expected. I went in just for, like I said, a routine mammogram. No lumps, because I think that's kind of like the first thing everybody thinks that you're gonna, feel or go through. But that wasn't it. I just went for a routine mammogram, and they found it.
Mm-hmm.
Yes.
And when you had that conversation with your doctor and you got the diagnosis, what did you do? What did you do after that? Did you know what to do after that?
Well, no, well, they told me to, suggested I get the, I can't say it. I'm sorry. The
The
biopsy.
ultrasound biopsy. Yeah. Uh-huh.
So I had the biopsy, and that's when it was confirmed. And that was in May of 2018. And June, I went in for my first surgery for them to try to remove the tissue and hope they got it all. And they didn't. I went back in July and had to have another surgery, and they still didn't get it. And I
Wow.
wanted, going in August of that year, and I had to have a mastectomy.
Mm-hmm. So 3 surgeries in 3 months.
Yes. Yes.
Wow. But did they get it all?
Yes. Yes.
Okay.
They did get it all. They did get it all. With the
Wow. Wow.
mastectomy.
Right.
Yes.
Right. Wow. So I'm gonna go. Thank you for sharing that, and we're gonna come back to you because we're gonna go to Dr. Hampton for a moment, just to talk about sort of, what are the statistics with Black women and breast cancer? Do Black women get breast cancer more than other women or not?
So we actually get breast cancer less than our white counterparts. However, our mortality rates or the death rates in Black women is higher. It's about 40% higher when compared to white women. And so those statistics for me have always been troublesome, because I think if we get less breast cancer, we should die at lower rates. And we have cancers that are actually slightly different. We tend to get breast cancer at younger ages, under the age of 50 when compared to our white counterparts. And we have a different type of breast cancer known as triple negative breast cancer that's seen more commonly in younger Black women. And that breast cancer is a more aggressive form of breast cancer. It oftentimes is found at a later stage, because many times our women can go in their 30s, and providers may think, oh, you're too young to have breast cancer. And so we really have to, as Black women, advocate for ourselves. And if something doesn't feel right, then you need to really advocate for yourself, for someone to do the appropriate workup and biopsy if necessary.
Yeah, my Wayne mentioned that this was personal to him. This is personal to me too. My medical school roommate got triple negative breast cancer in her 30s and unfortunately passed away. And, the question is raised, why do Black women have these more aggressive forms of breast cancer and at younger
And
ages?
that's the question that we're trying to answer. We think there's some genetics involved, but this leads into what we see across all disease states is there just aren't enough of us getting involved in clinical trials so that we can find out those answers and find out, well, maybe there's different medications that work for us. Maybe we need different screening guidelines. And so, I really am a big advocate that we as African Americans and people of color, we have to get involved in these trials so that we can get the answers for generations to come.
So what ages should we start getting screened? We heard from Sandra that she had a routine mammogram. Thank God. She had that routine mammogram. Since Black women get breast cancer at earlier ages, what ages should we be getting screened at?
So in general, everyone should be getting mammograms starting at age 40 and should be getting it every year. However, the American College of Radiology has deemed actually Black and Jewish women at a higher risk for breast cancer. And so they are recommending that starting at age 30, Black women and Jewish women start getting what we call a risk assessment. What that means is that you go into a doctor, to a breast specialist, talk about family history, talk about breast density, talk about some other risk factors that you may have. And then we may decide that that woman may need to start getting mammograms at age 30, or we may say she needs to start at age 35. And so it's really doing a personalized assessment and then making a decision there. But, I agree. I think Black women wait time they just said, no, we are not going to be doing that. We're going to start at least at age 40 and earlier if we know there's a family history.
Right. Wow. So you get the diagnosis, right? You get this diagnosis of breast cancer, like Sandra got her diagnosis. What is the first thing that you should do in terms of getting treatment? Let's start with, who do you go to? So you've gone to your primary care, you got this mammogram. What's the first stop after that?
So usually they're either going to send you to a breast surgeon or to a medical oncologist. And it's really about building a team. And so if you go to the surgeon first, we'll send you to the oncologist. If you go to the oncologist, they're going to send you to the surgeon. And then it's really about us as a team working together. And that team includes the radiologist who looks at the films, the pathologist who looks at the biopsy results, the nurse navigator. So we now have navigators who help really walk the patients through the process, because many patients don't know what is a surgeon, who is an oncologist. And so the navigator can help to guide the patient through that, help them to get appointments, help them to get second opinions. So it's really about building a team around each patient. And one of the first things I tell people to do when they get the diagnosis is just to pause, take a deep breath, and exhale.
Right.
Because you're going to be okay. And I know it's hard, and there's a lot of, all these things start going through your mind. Stay off Dr. Google, because there's just a lot of overwhelming information, and trust that your team is going to really walk you through the process and educate you through the process so that you can make the right decision for yourself on how to be treated.
So there's some doctors, hospitals that are better than others. How would you suggest that somebody, sort of get the best treatment for them?
So I think it's looking at a center that has a breast center. It's known as a breast cancer treatment center, and they have a team-based approach. I often think, talking to friends and family and finding out their experience. People will tell you where they think you should go and where they think you shouldn't go. And I think it's looking at the credentials of the providers that are within that organization and within that hospital or institution, and making sure that it's the right fit. And what I tell people is, if it doesn't feel like it's a good fit, then go get a second opinion. It's okay. You can do that. But I think there's nothing worse than being in a place where you just don't feel cared for, where you don't feel heard, where people are really ignoring you, they're treating you as a number, it's okay to go and get another opinion.
Right. Absolutely. Great advice. I tell people that all the time. That's what I wrote. That's what the show is all about. So there are different kinds of breast cancer, right? Why is it important to know what kind of breast cancer you have?
Because the treatment is going to be based on the type of cancer that you have. So you can have something called DCIS, or ductal carcinoma in situ, which is known as stage 0. Usually those don't require a lot of aggressive treatment. Usually those patients don't get chemotherapy. Usually it will be surgery plus minus radiation plus minus hormonal therapy. If you have a hormone-based cancer, a cancer that is estrogen or progesterone positive, then you're going to get a hormone-based treatment. And then if you have triple negative breast cancer, you will need chemotherapy. And that's what I tell all my patients with triple negative. Chemotherapy is probably the most important treatment for women that have triple negative breast cancer. And we've actually changed over the last few years in that, because we know it's the most important treatment, we're going to give that medicine up front, even before I even do surgery. And the great thing about it is, when we do that, in most cases, we can wipe the tumor away. There are many times when I'm only going in and just taking out the clip that was placed at the time of the biopsy, because there's no tumor left. And so
Wow.
that's really
amazing.
exciting.
Yeah. So Sandra, back to you. How much do you feel like these kinds of things were explained to you? Do you think it would have been easier if they weren't? Do you think it would have been easier, or easier in your journey if you knew some of these things up front?
I think I kind of knew a lot about, examining yourself and going to get your regular mammograms. My doctors were really, really good. I had a good team of doctors, and they explained everything.
Wonderful.
Like she said,
Wonderful.
the teams came together, and I have a really good oncologist now. So
Wonderful. Wonderful. And how often are you continuing to see your team now that you're sort of out of that initial phase of the surgery, etc.?
Well, I'm going every 6 months between my oncologist and the surgeon. More so the
Okay.
oncologist every 6 months, and my mammograms. I'm sorry, regular mammogram every 6 months. So I
Great.
go to the
Great.
mammogram, then I see the oncologist right
Right.
behind.
So it's an ongoing journey. It's not like you have breast cancer, you had the surgery, boom, you're done.
Right, right. I think next year, my 5th year, they'll probably move it up to a year.
Okay. All
So
right.
I'm
Good.
going
That's
on my
something to look forward to.
5th year. Yes,
Yeah. So it sounds like, Sandra, you did not have chemotherapy, right? You only had surgery.
just surgery. No
Okay.
radiation, no chemo, no medicine.
Wow. Wow. That's wonderful. But for a lot of women aren't that fortunate, and they do have to have chemotherapy and radiation. So, Dr. Hampton, what are some of the side effects that women might experience as they go through these treatments?
So with chemotherapy, some of the side effects are nausea, vomiting. People can get a little bit of nerve damage where they get kind of numbness and tingling. There can be some joint aches. Some of the chemotherapy medicines, and depending on the dose, can cause some heart problems. And so the oncologists really monitor the heart function when they're giving those medications. With radiation, you can get some darkening of the skin, especially while you're going through treatment. And most people by the end of radiation just say they feel really, really tired. But then their energy starts to come back after. I think one of the good things about the medical oncologists is they really have a lot more medications that help to kind of stave off those side effects. So I know most of my patients, the chemotherapy is given as an outpatient. They continue to do their normal daily activities, being a mom, driving kids to school, continuing to work. And I think those things are really important for the psyche of women, because I think, as women, we want to know that we can keep it moving. We got things to do. And so I think that really helps women to know, you know what, this diagnosis is not going to hold me back. I can continue to do the things. I may do them a little slower, but I still can do the things that are important to me.
Right. So you mentioned, just moving along with your life, getting the treatment. What are some, though, of the lifestyle changes that women might have to make? Let's start with you, Sandra. What are some of the things that you were counseled on and that you've decided to incorporate in your life since getting the diagnosis of breast cancer?
It was just getting used to having, having mastectomy, one breast, deciding if you wanted to get the implants or, just which direction you want to go with that. And it's an adjustment.
Yeah.
Yeah.
I know you had mentioned moving towards a plant-based diet, right?
Yes, I have.
Okay.
Recently.
Okay.
I'm definitely doing good with it. Yes.
Okay. All right.
And a
And
little more
Dr.
exercise and walking
Okay.
and treadmill.
All right. Wonderful. Wonderful. That's great. So, Dr. Hampton, any specific advice in terms of lifestyle modification, changes that people make in their choices after a breast cancer diagnosis that might, make treatment easier or make it so that treatment will be successful or there won't be a recurrence later down the line?
Yeah, I always recommend that people sort of re-examine, and I often find and ask patients, well, where's the real cancer in your life? Is it work? Is it family? Is it, is it our neighbor? Who is it and what is it? And I often find that when people just make those changes and start to move toward what makes you happy, what are things that are important to you? Because I think as women, we often lose ourselves by doing for the kids, doing for our husbands, doing for our partners, doing for our parents, that we don't often put our needs and wants first. And so I love watching women as they go through that transformation of really taking their power back, of saying, you know what, I'm going to get rid of this cancer, but then I'm also going to start to put myself in happy places. And not everybody's going to like it. Not everybody's going to travel that journey with you. But at the end of the day, women being happy, I think, is so important. In addition to following your recommendations from your specific breast cancer team about, how to manage yourself afterwards, certainly continuing to get mammograms, unless you've had a bilateral mastectomy. That's about the only time that we don't recommend getting mammograms.
No, that's excellent. And I know too, sometimes quitting smoking, people also don't understand sometimes the connection between alcohol and breast cancer risk and the need to sort of cut back on how much alcohol that you might consume. Sandra mentioned, exercise and the role of exercise and decreasing, just being more physically fit, obesity being a risk factor for breast cancer. So some of those other things that can also affect your risk down the line, risk of recurrence. But I love that point that you made. I don't want that to escape, the importance of self-care and identifying where is the cancer in your life. That is just so profound. On that note, we have to bring the audience into this discussion and get questions and the comments coming in from the chat. So Wayne and Bria, what are you all seeing out there?
Here we go, Doctor. We're here finally. Great discussion. Great, fantastic discussion. Well, we're hearing got a few questions out,
Okay.
and a few statements. One, I want to pull up Valerie Blackwell, 4-year NED. stage 2 TNBC survivor thriver. Can you explain that for us, Dr. Hampton?
So hi, Valerie. Sounds like she has no evidence of disease. That's NED. She's a stage 2 triple negative breast cancer survivor. So bravo.
Oh, wow.
Bravo.
Fantastic, Valerie.
Way to go, way to go, way to go. Let's do this for her.
We love that.
And you got one, Bria?
Yeah, I do. So you both kind of touched on a little bit about the frequency of screening. So is there a difference in the frequency of screening between those who may be breast cancer may run through the family versus those who may not have that gene running through the family? Like, is there a difference in how often people should be getting screened based on that?
Great question. Dr. Hampton?
Yeah, so family history is important. And as we know, in Black families, we don't often discuss our health history. So it is really important to know who had cancer and the age, because we want to start 10 years earlier. So if mom or grandma were 42, then the women in that family should start getting mammograms at age 32. So age 40 is the standard, but again, if we have that family history, and again, I'm going to encourage all young Black women to go and get that risk assessment, because some of you may need to start getting mammograms earlier than age 40, even without a family history.
Fantastic.
Thank you.
Thank you for that. We have Valerie Spalding Parker said, I'm a high risk for breast cancer. I get a mammogram, a breast MRI, and 2 breast clinic appointments every year. So we want to salute her also.
Wow.
We want to salute Valerie.
I'm assuming that means at genetic high risk. Would that be correct, Dr. Hampton, with that protocol that she mentioned?
She had a that shows something called atypical hyperplasia. And atypical hyperplasia is not cancer, but it can be a precursor to cancer. And so we will follow those women in that high risk fashion.
Great. Thanks for clarifying that. And thank you for sharing, Valerie.
I have another question. Does socioeconomic income, where you are in society, determine whether you'll have successful outcomes with breast cancer?
Another great question. Dr. Hampton?
It shouldn't, but unfortunately, in some communities it does. Now, one of the good things is that through the CDC, there's the breast and cervical cancer program, and that's available in all 50 states. So women who don't have insurance should be able to go in to their local state health program and be able to get coverage to help get mammograms. If they get diagnosed with breast cancer, it covers treatment, even covers reconstruction as well. But unfortunately, we know about health disparities in some communities. But I think, if you're a woman in this community and you don't feel like you're getting the best care, find a way to make it to another community. Hopefully it's a neighboring community so that you can get the care that you need and deserve. Your zip code should not determine your outcomes.
And Dr. Hampton, you've done something very specific in this area, right? With Breast Care DC?
Yeah, so I co-founded a nonprofit called Breast Care for Washington that's located in Ward 8 in Washington, D.C. And our whole goal was to bring state-of-the-art breast cancer screening to that community. Ward 7 and 8 in D.C. have some of the higher mortality rates in the D.C. area and actually in the country. And so for me, it was important to bring 3D mammography screening, which is state-of-the-art. That's what they have across town in the upper parts of Northwest. And so it was important to have that right there in the community and be able to provide that access to women.
Excellent. Trying to level that playing field. What else do we have? Any other questions?
Yeah, I'll go ahead and give you the next question. And this is from Linda Marshall. So it reads, after my diagnosis and during my treatment, I felt surrounded by a team. When the treatment ended, I felt like I was standing by myself. Had to adjust and try to understand the changes to the body, which didn't stop trying to understand it. Do you recommend support groups? Do you know any support groups that can help? Thank you for sharing that, Linda, by the way.
Yeah, thank you.
Yeah, I absolutely recommend support groups. And now that we're all in virtual spaces, you can find virtual support groups. There are many organizations. Most hospitals offer some form of support in a support group, but there's no need, Linda, to feel alone. There are many women out there who walked your same journey who can provide support for you, because we know once the treatment ends, sometimes that's when the new journey begins in survivorship, and some of the challenges that come with that. So please don't be alone. Reach out. There are many, many women and organizations that can walk with you through that survivorship journey.
Thank you. Sandra, anything that you want to add from your perspective?
Go get the yearly mammogram, definitely. Just yes.
Definitely. Okay.
Sandra, and I must share with everybody, full transparency, I've known Sandra for quite a number of years. I don't want to get into how many, because I don't want y'all trying to figure out either one of our ages. So look.
Since junior high, though, right?
Since junior high school.
Yeah.
Yes.
Okay.
We were in the same community in high school, and if you know the Washington D.C. area, we were at Suitland High School.
Hey,
so I see all the Suitland Rams out there. She said, "I already know." Tracy Walls pops in. I already know. We love you, Tracy. Anyway, so I just wanted to say I watched her journey, and the amount of strength that she has showed and possessed. And I don't want to tear up here, but an incredible woman we are looking at, and managed to go through quite the crisis. And I'm just so proud of you and what you've been able to do.
Yeah,
Absolutely.
it's definitely been a journey.
And also to share your story tonight. We are very
share
thankful
your story
for that.
is incredible.
Thank you for having me.
Now, Dr. Mel, I might have to take over for a second, just for a second, Dr. Mel. I'm sorry.
Okay.
Sorry, I'm in my mode, Dr. Mel. And
you're on a roll.
I'm on a roll. And full transparency for everybody, I've known Dr. Hampton before she became a Dr. Hampton. So I'm proud that she has become a leading surgeon in this field, and very proud of you and your accomplishment. I'm really proud that this young lady has grown into this. Can I get a loan? Can I get a loan?
A little sketchy back in the day. Didn't know which way I was gonna go there.
Right. It's a little sketchy. A little sketchy. Do you owe me money? No, I don't think so. But nonetheless, I mean, it's incredible the things that you've accomplished in your life and the work that you continue to do for our community, not only our community, but just our sisters, our mothers, and men. So, Dr. Hampton, how many men come up with breast cancer?
So men account for only about 1% of all breast cancer. So it is a small number. One of the good things is, men, most men at least, have less breast tissue than women. So usually if they have a lump or abnormality, it's going to be a little more obvious than it is for a woman. And their treatments are exactly the same. They can get a mammogram, they get an ultrasound, same biopsy, they can get the same surgeries, they can get a lumpectomy, they can get a mastectomy. I haven't seen men get reconstruction, but I guess if they want it, they could be. We're going to be equal to everybody.
They're getting implants. Men are getting implants.
They can get that too. And then and they can also get the hormone therapy if their type of cancer calls for it.
I think the most famous gentleman in our community that's gotten breast cancer is Richard Roundtree. I remember that.
Wow.
Shaft.
Okay.
Shaft.
Yeah.
Talk about Shaft.
Yeah.
But
That's right.
He came up with
That's
that.
right.
So you can have your show back, Dr. Mel.
Well, I mean, you did brilliantly, and I just want to do a last check and see if there are any questions lingering out there.
It is a statement. Valerie also said my mom had pain under her underarm, and they found it was breast cancer. Is that common?
Good question.
Not common, but it is known that the breast tissue does extend under the underarm. So we often tell women it's important when you're doing your breast self-exam and checking your breast that you not only check the breast proper, but also to check under the arm. And if you feel something abnormal there, to get that checked out.
Okay.
And so are breast self-exams still recommended by doctors?
I still recommend them.
Good.
You know, I think it's important because at one point they were saying that some doctors shouldn't do clinical breast exams. So they were telling women, you know, don't do breast self-exams and telling doctors not to do clinical breast exams. So who's going to examine the breast? I feel like we live with ourselves every day. We should know our bodies, or our partners should know our bodies. And if something is abnormal, then you go to the doctor and let them know, hey, I got something right here. This needs to be checked out.
Right.
So
And
I'm
a lot
so
of
happy.
partners, a lot of partners discover lumps. So yes, self-exam is important. It's important to do it at the same time of the year, right? Same time of the month, right? In your cycle, because your breast tissue can change with your cycle. So doing it consistently at the same time every month is really important. Well, this has been an incredible show. Thank you so much, Sandra Hawkins Beard, Dr. Regina Hampton. You all have been incredible guests. Thank you so much for joining us. Thank you to the audience for the wonderful questions and comments and everything that you shared to make this an even richer episode and richer experience, to get this information out there to our sisters that need it, and our brothers. You mentioned, thank you for reminding us, Wayne, and for the brothers that love the sisters too. So very important for us all to take this very seriously and provide support for each other, so that no one has to feel like they're alone going through this. Now, before we go, those of you who tune in on a regular basis may have heard me say this. So, know that there is a special research study going on at Howard University about COVID resilience. So how have you been coping during the pandemic? It's 2 surveys. You get compensated up to $100 for participating, totally voluntary. But if you have any interest, reach out to Dana Harvey at this email, Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research@gmail.com. And she will tell you everything about getting enrolled in the study, filling out the surveys, and getting that $100 compensation. And if you've already done it, tell other people, get them involved too. Let them know that they can just email Dana Harvey, research@gmail.com. Well, it's that time. Thanks for tuning in. Thank you to my Be Health Empowered family. And remember, we'll be back here very soon. And until then, be wise, be well, and be health empowered. Thanks for joining us.
So I guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry.